Hi there, my name is Robin and I'm going to explain how I got my 2-year-old to stop sucking his thumb for good using the Mavala Stop Nail Polish by Mavala, Switzerland. This is not medical advice, so please consult your medical provider if you plan to use any nail products on your child. So Mavala Stop is a clear nail polish that goes on with a glossy finish and can be applied every other day in a single coat to your nails for as long as you need it to kick the habit of putting your fingers in your mouth. So this is well suited for children and adults that have problems with thumb sucking and nail biting. The way that it works as a deterrent for putting fingers in the mouth is that it tastes really, really bitter. So for those of you who are familiar with bitter melon, it tastes like bitter melon in its raw, unseasoned form, but 10 times the potency. So for those of you who know what I'm talking about, it is super gnarly. Why do we use this on such a young child? Our son has been sucking his thumb since he was practically a newborn, and it was getting progressively worse. He was spending more time on it every day, and it was getting in the way of his eating, talking, and socializing. So it was impacting his development to some extent. And we had noticed physical changes in his teeth. His top and bottom front teeth were actually flaring out, so they were sticking out due to the constant pressure of his thumb against his teeth. So we brought up these concerns with our pediatric dentist who recommended this product, and she gave us explicit dental clearance for using this on our 20-month-old at the time. She had informed us that any damage to the teeth or to the facial bone structure can be permanent from thumb sucking, especially if those habits last beyond the age of 3. So naturally, we were concerned, eager to do something about the thumb sucking habit and getting it under control. So we applied this as directed on my son's nails every other day at night while he was sleeping. If your child is hard to keep still, apply this at night while they're sleeping so it can properly dry and not be wiped off or eaten right away. We noticed after the very first use that it was already beginning to work. Our son was still putting his thumb in his mouth because it was second nature to him at that point, but he would slowly take it out of his mouth, and he continued to do that for the first day, and it was actually pretty funny to watch. And by the third day, he was basically off his thumb, and he didn't seem to have any desire to stick any fingers in his mouth. So we were absolutely floored by how well this worked and how quickly it worked. It's been about 2 months now since we stopped the product. He hasn't had any relapses with his thumb or any fingers. I can review this again at 6 months to a year just to see if the results lasted. And in addition to that, in the 2-month period, his behavior has completely changed. He's saying way more words, probably 20 more words. And that includes partial and complete sentences. He's also a lot more sociable and friendly, and our friends that we see weekly have noticed the change, and they've actually asked what we have been doing differently. Even though he's at the developmental stage where he's supposed to be more sociable at around the 2-year-old range, we do think that getting him off of his thumb has helped tremendously. Some things to note about using this product is putting your fingers in or around your mouth gets that bitter flavor to come through. So I think the manufacturer recommends using silverware to eat your food while you're using this product. And we actually fed him for the 10-day duration that we used it. If you cook or you prepare food in any manner, then it's a good idea to protect your food from your nails. So by wearing gloves, you can prevent that bitter taste from coming through to your food. I forgot to mention that we continue this product for a total of 10 days, so a total of 5 applications because it's applied every other day. And we just did that to make sure that his thumb sucking stopped for good. Another thing to note about this nail polish is that it is not recommended for children under 3 years of age. The manufacturer does not explicitly state what the reason is for that, but it does say on the box that with small children, the efficacy can be compromised as their taste buds are not fully developed, and therefore the bitter taste of the product may not be effective. So that's something to consider if you're thinking about using this on a child less than 3 years old. We used it on our 20-month-old because we got dental clearance, but that is something to think about. Another thing is that a lot of parents express concerns about the safety of using nail polish on a small child. I looked up every single ingredient, and it's MSDS, which is a material safety data sheet, which is a document that explains the potential hazards of a chemical product. So that includes hazards on health, flammability, reactivity, and the environment. Most of these products are flammable, and a lot of them are classified as either eye, lung, stomach, or skin irritants. And of course, we don't know the extent of these hazards when these ingredients are included in a nail polish, but we can't say that it's harmless because after all, we are applying it on our nails. So as with anything, you do have to assess whether the benefit of using it outweighs the risk of temporary exposure to these chemical products. And that's exactly what I did before I used this product. First, I researched it, I applied it on myself, and once I was comfortable, that's when I applied it on my son, and I committed to a 3-day trial. If he hadn't improved or if I was uncomfortable with using it at all, I was just going to stop the product and think of a different intervention to stop his thumb sucking. Another thing that you can do is if you're worried about excessive application, you can always just put a dot on each fingernail. Children's fingernails are really tiny, so that's pretty much all they need, and it should still work. Some of the things that I considered before using this product on my son were the exposure to the chemical irritants in this nail polish. I considered the fact that he might stop sucking his thumb at some point on his own. In addition to that, we knew that sucking his thumb is a coping mechanism, and it's also a self-soothing mechanism. So getting rid of that made me have some reservations about getting him to stop thumb sucking. Pacifier use, any sort of baby bottle long-term can induce damage to the teeth and to the facial bone structure that can be permanent. So I asked my pediatric dentist what interventions that would require to fix. And she said that it could range from braces, which is relatively painless and very common, all the way up to different types of maxillofacial surgery, which is very invasive. And there's risks associated with the surgery itself and with general anesthesia. So I decided that the benefit of using this product and potentially stopping the thumb sucking forever would outweigh the risk of temporary exposure to the chemicals in this nail polish. Of course, you have to make that decision for yourself, but I wanted to be really thorough in this review and just disclose all the potential risks and the benefits of using this nail polish. Mavala Stop is widely vetted by a lot of parents and adults that have used it. If your child is under 3 years of age, I do recommend that you get medical clearance for using it. Overall, I'm really happy that I tried it. It worked for us. I hope that you found this video review helpful, and thanks for watching.